Health America. I'm your host, Dr. Michael Noor. You know, every now and then, some of these childhood diseases we think are gone come back. So today, Mr. Joseph Ngata is going to talk to us about an epidemic which is fairly widespread around the country. Welcome to our program.
Thank you for having me.
Tell us a little bit about your background. What are you doing these days, Mr. Ngata?
I'm going to be a fourth-year student at UC Berkeley, and I'm majoring in public health with an emphasis on infectious diseases and epidemiology.
And where are you from?
I'm from San Leandro.
And how did you get interested in this?
I'm part of an internship with the Ethnic Health Institute at Alta Bates, and I heard that there's like an outbreak going on, and I just got hooked on it.
All right, so tell us about this outbreak. What is the disease?
Pertussis is a bacterial infection of the respiratory tract, and it's caused by a bacteria known as Bordetella pertussis. And what happens is that the bacteria invades the lining of the respiratory tract, and that's what causes inflammation and leads to an increase in the secretion of mucus, and that's what causes the uncontrollable and violent coughing. And it gets its nickname, whooping cough, from the sound that people hear when patients try to inhale after one of these coughing attacks.
You know, most children are immunized to pertussis, and most people think that it doesn't exist anymore. Why are we so interested in it now?
Recently health officials have declared pertussis as an epidemic in California, and the California Department of Public Health is worried that the state is on pace for having the most illnesses and deaths related to the disease in the last 50 years. There have been over 1,500 cases of pertussis in California so far, and 6 deaths in infants. 5 out of the 6 have all been under 3 months of age. And in addition, there are 600 more possible cases of pertussis that are still being investigated by local health departments.
Tell me why do you think we have an epidemic? Don't most children get immunized for pertussis, and is the immunization an effective immunization?
A lot of kids don't actually get immunized, but they should, because it's a many factors. So a lot of people don't really know which vaccines to get, but they should be getting the DTaP, which is the diphtheria, tetanus, and pertussis shot. So it's all 3 of those shots rolled into one vaccine. And children need 5 doses of that. So they need it at ages 2, 4, and 6 months. They need a 4th shot, which is a booster shot, given between the ages of 15 and 18 months, and the 5th shot, which is an additional booster shot, given between the ages of 4 to 6 years, so right around the time when kids start going to school. However, what many people don't know is that protection fades over time. So that's why it's recommended for kids to get the Tdap, which is a booster shot, and that protects against the same diseases, tetanus, diphtheria, and pertussis, and that's recommended to be given at age 11 and continuing every 10 years thereafter.
You know, there's a lot of controversy now about immunizations. As a pediatrician, I've given lots of immunizations and recommend them that they be given on the regular schedule. Why do you think people don't want to get their children immunized? Why would you? What would be your sense of that?
A lot of people are worried about the effects of these immunizations. So some people hear stories about vaccines being related to autism or related to sudden infant death syndrome. And actually, a lot of cases from the CDC and like the Food, Drug and Administration, they've all made tests and they haven't found any connections between those.
So that the data's out there. There's a lot of hearsay evidence about immunizations, and every now and then you get these epidemics that show you that these diseases are still around. I mean, I remember when I was coming up, whooping cough was very, very common, and a lot of kids died from whooping cough. And I think we just kind of have forgotten that. Can whooping cough be treated?
Oh, yes, sir. And treatment is mostly in the form of antibiotics. So if given early enough, antibiotics such as erythromycin, for example, can help the symptoms go away more quickly. However, many patients, unfortunately, don't get it quick enough, so about 3 or 4 weeks after the initial infection. And at that point, the antibiotics aren't as effective. However, they do help reduce the patient's ability to transmit the disease to others.
From your reading, and I know you're not in medicine, what are some of the things that people should look for as clinical evidence of pertussis?
So one of the main things is when a person first becomes infected, there's usually an incubation period or a period before the symptoms arise for about 7 to 10 days, but it may last up to 21 days.
And what happens in that period?
Usually, for the incubation period, not many people are able to detect it because symptoms don't really arise yet. But after the incubation period, there's usually a week or 2 of cold-like symptoms. So you have sneezing, stuffy nose, congestion, and after about 2 weeks of that, then the next stage, so the coughing stages where kids just cough repeatedly over and over again. That usually lasts for about 2 to 4 weeks, but may last longer in certain patients. And in this stage, patients just cough until there's no more air left in their lungs, and they're forced to inhale, taking a deep whooping sound. And that last inhaling that they do is just a desperate attempt for them to breathe and get oxygen. And some patients even turn blue at that point.
So what is the health department saying now we should all be doing?
Oh, so now it's very important that not only to get the DTaP for your kids, but also to get the Tdap booster shot. And it's important for people to get that booster shot every 10 years. But there are special cases when a person gets the booster shots in less than the 10-year time intervals that's recommended. And these include when there's a pertussis outbreak in the community, or when a person is going to be coming in close contact with infants, pregnant women, and young children. So healthcare workers are definitely urged to get vaccinated. Pregnant women themselves are also urged, and they can do so before, during, or after pregnancy. And new fathers as well are encouraged to get vaccinated, preferably before the birth of their child.
Well, Mr. Ngater, that was a very good discussion of that. I mean, I think it points out to our audience that these immunizations are given for a reason. And when you don't get your children immunized, it puts the whole herd at risk. And so your recommendations of the regular shots during up to age 4 and a booster shot every 10 years after age, 15, 14?
11.
After age 11, I think is a good recommendation. So here again, there's an evidence that non-immunizations can certainly cause problems. An epidemic has been declared in California and other parts of the country, so you should be prepared. Thank you again, and we'll be right back after this break.